My name is Dr Maricia Duvenage. I'm a general practitioner working at the Renewal Institute with a special interest in aesthetic and integrative medicine. Our approach is unique at the Renewal Institute when we look at health, in that we not only look at the symptoms of a presenting condition, but we also take note of what may be the cause. Acne, in a nutshell, is basically an overproduction of the oil glands and then blockage of the way out for the oil. So you get an accumulation of oil inside the follicle or sebum gland, which is the oil gland, and then bacteria and toxins get entrapped in this pore, which causes inflammation and eventually the formation of the well-known pimple, which is a layman's term for acne. Acne can be part of puberty, as to per se, with a hormonal issue, or it can be poor skin care, where we definitely will make an impact on the management of the condition. The skin is the dashboard of the body. If we compare it to the functioning of a car, so when you drive in your car and something is wrong in the engine, for instance, you will see a small light appear on the dashboard to tell you that something's wrong, and the same is with the skin. And usually skin conditions like acne presents due to internal inflammation or food intolerances or hormonal imbalances, and this tells us that we need to go and look for the cause to be able to treat the symptom correctly, which will be acne in this instance. It's usually entrapment of bacteria inside the skin or poor skin hygiene, which can cause inflammation in the skin and blockage of the pores. Some people over-exfoliate their skin, which can lead to inflammation and acne. And what we usually see in adults is more your dry skin acne as opposed to your oily skin acne in teenagers. This is where the protective barrier of the skin is actually impaired and you get penetration of bacteria and toxins and pollutants in the skin, which will then cause acne. Or if a woman or a man is going through the hormonal changes later in life where they stop producing hormones, you may also see the prevalence of acne in this population group. Lifestyle has a direct effect on the prevalence and the severity of the acne. Due to our poor lifestyles nowadays with the Western diet and processed foods, you get a lot of food intolerances that people aren't usually aware of, and the acne might be the only symptom that leads us to this. So what we do at the Renewal Institute is we usually prescribe an anti-inflammatory diet. What we oftentimes see in gut health when it pertains to the acne patient is that they often have very low stomach acid, and you need this amount of stomach acid in your gastrointestinal tract to protect you from these bacteria. It basically destroys harmful bacteria that seeps into the bloodstream through leaky gut. So we always ensure that we address leaky gut with the acne patient. First of all, we want to eliminate the triggering factors for inflammation in the gut lining, so we prescribe an anti-inflammatory diet. Then we usually give clients stomach acid in the form of betaine hydrochloride to ensure that the pH of the stomach acid is acidic enough to destroy these harmful bacteria in the gut. We also need this to properly digest food so that you don't sit with undigested food particles which may leak into the bloodstream again. Then it's very important to have the right amount of good bacteria in the gut. This way, we replace this by a good quality probiotic to ensure that there's a wide number of species inside the gut to create a competition for the bad bacteria, so that you know you have a balanced ecology inside the gut. And then we usually give the client a good amount of amino acids, especially glycine and glutamine, and these act as building blocks to repair that damaged barrier to prevent the leakage of these harmful proteins into the bloodstream. The most important thing that people shouldn't do when it comes to acne is to squeeze these nodules, because you cause more inflammation, and inflammation will lead to pigmentation and scarring. So leave it alone until it pops by itself or when it's ready to be removed professionally. Then do not eat processed foods. Take care of yourself. If you do, then you will cause more damage in that you will add to the cause of the acne. And then it's also important to follow a good skincare regime to ensure that you're on the right products to help with exfoliation and healing of the skin, but you also get different stages or grades of acne. So if the client has a very reactive skin, those large nodules which are red and inflamed and painful, what we want to start with is skin preparation. And what we do there is we need to calm down the skin and apply very light exfoliating treatments for these nodules to come to the surface and for the skin to start healing. Once the skin is less inflammatory and less reactive, we can go into our more deep or more intense chemical peels to help cleanse these pores and help with the exfoliation process. We have medical grade lasers, and we incorporate these in different phases of the treatment. It's usually an add-on treatment to the chemical peels that we do. The laser genesis is more of a mild laser that we use to encourage healing and the production of the right kind of collagen in the skin to support the skin integrity. And it also helps with clearing away the inflammation that's caused by these acne nodules. Then we also have the Titan laser, which is a little bit more aggressive than the laser genesis that I've just mentioned. This is used then to bring the deep nodules, the cystic acne nodules, to the surface, to pop for the inflammation to get away and for the skin to start healing. Then we also have our fractional lasers. These are mainly used for very severe acne scarring, which it works by drilling small little holes into the skin to allow deep exfoliation and collagen stimulation of the skin. But that is on the more severe side of the spectrum in terms of laser treatment. Scars are very, very difficult to treat because you have to remodel the structure of the skin. So it's very important to establish the expectation of the client and making sure that they understand how their expectations will be met.